So good afternoon to all of you, and we both are happy to have this opportunity to present our paper on adult education, social selectivity and inclusion, the evidence from Slovenia. Namely, we come from Slovenia, but from two different institutions. Even three, yes, different institutions, yes. So my colleague is coming from the Institute of Social Care and Social Protection. And then we have a colleague of ours who is today not present, but he's following us. And he's coming from the Institute for Inner Peace. And I'm coming from Slovenian Institute for Adult Education in Ljubljana. So, in fact, in our paper, we started with the well-known, but still very relevant question that participation in adult education is, in fact, one of the key factors for personal development, for economic development or employability of people, and also of social inclusion. But on the other side, there are quite a lot of people that are not involved in organized educational processes. And that means that it's not only important how much people participate in education training, but also who participates and who is systematically left out. So from the theoretical perspective, participation in adult education is a sort of inclusive participation, which means that people who have access to social and economic cultural capital, who have a higher rate of formal adult education, definitely people who take more or are more active in organized education activities, and the opposite, people who have lower access to cultural or to social capital, in fact, are excluded from educational processes. And that leads to what we call or conceptualized as the social structure of adult education participation. So in our paper, we try to test three objectives. And first is to test whether participation in adult education can be predicted from different individual educational occupation and special characteristics using a live labor force survey data and based on binary logistic regression. Then to demonstrate the social selectivity of participation by identified groups which are systematically left out or have lower rate of participation, and to discuss implications for inclusion of people with disability in the deinstitutionalization process, and to outline a planned intersectoral implementation pathway, leveraging study circles as a community learning infrastructure to be mentioned and evaluated. Maybe a little bit about our methodology. As I said before, we used a labor force survey, which is European survey, but we use just results and data for Slovenia, basically, except in this part. We used a sample of adults between 25 and 64 years old. And our most important variable or dependent variable was participation of adults in organized educational activities. In fact, we took into account formal and non-formal education, and other variables that I will show later are independent variables. In terms of participation of adults in organized educational activities, Slovenia was quite good 2 years ago. Namely, Slovenia was above the European average. It was not so good like some North European countries, Sweden, Finland, Norway, but it was not bad. However, I have to emphasize that almost 80% of people do not participate in education in the last month before the survey. We found out that in fact, participation in education is strongly socially structured, which means that there are some factors that are very important in determining the level of participation. For example, one of the most important is age. So younger people are very active in educational processes, and older people, particularly above 50 or 55 years, are not so active. Also, education, the level of formal education people have, is a very important factor. Which means that people having completed secondary education, particularly general secondary education, are much more active in education, formal or non-formal. Also, gender is a factor determining a level of participation, but not so important. In Slovenia, it is quite interesting that women, unlike in your country, are more active in education than men. And we're trying to find some measures to support men to become more active in educational processes. We found out that people from abroad or migrants are also very passive. And I think that one of the problems that they have is the language problem, because, you know, in Slovenia, we don't speak so much English, or educational programs are not running in English language, but they have some language problems. And also the level of regional level, where people live, in which part of Slovenia was very important, and also whether they live in big cities or smaller cities or rural places, which means that people living in bigger cities have better access to educational institutions, while people living in rural areas have very low level of participation. And that was quite interesting for us, because after the period of COVID, quite a lot of education was going on via distance learning. And that's why we expected that those people might participate much more than they used to in the past or before the COVID processes, the COVID time. However, that wasn't the case in Slovenia. There was one important factor, the employability, whether people are employed or unemployed. Employed people are much more active. And also important was the level of disability. The level of disability, in fact, was not part of our model due to the limited number of people that were involved in our research having any sort of disability. However, we elaborated this data, and they were very indicative. Namely, they showed that people having any sort of disabilities are very rarely involved or engaged in any kind of educational processes. So people with some disability participate almost twice less than those without any sort of disability, and people with severe disability are quite excluded from these processes. And I think that this is not just an educational problem, but it is also a general problem, because people being less involved in education, in fact, are also less involved in public life, or they have less or lower access to different community engagements and social networks and so on. In fact, this was just a basic or empirical evidence for the rest of our paper.
Yes.
So thank you very much, and I'm giving the floor to my colleague. Thank you.
So my side is more practical. I'm very proud to be here with my colleague, because I think that we're all talking about different disciplines come together and work together, but rarely we really do it. So we have this third partner that I will present later, and he's our colleague, and he said we should connect and get to know each other better and do something with it. So I come from practice, and I just showed you these keys on different papers, and I would like to present the it's not project, it's not movement, it's something we do in Slovenia right now, and it's part of European idea for less than 100 years, but we did it in waves 3 times already in Europe, but still not succeed. And it's a very difficult word. It's called deinstitutionalization. But what I want to say and make it more easier is these keys. It means that people who live in institutions have their own house, their own keys, and their own life. So what we want to do is close up all the institutions where people with mental health issues, or maybe intellectual disability, or even other, many times now when we are really doing it, is poverty. The reason that they don't have their own place. Slovenia is neighbor of Italy, and we didn't have a war after well, we did a small one, but after the Second World War, and now it's time to do this step forward as humanity and close these big institutions where people live. They have food, they have roof, they have room, but they don't have the dignity. They don't have the humanity that all the rest of the Europe has. Not everybody, of course, there is a war also going on, not so far, but in Slovenia, we could move and do the step forward. In Italy, it was Franco Basaglia from Trieste that did these steps 10 years ago, or 50 years ago. And we're still looking to his solutions. He was a psychiatrist. And we also learned from England right now, from Czech. They already did these steps. And there are strategies, European strategies, that say that European countries have to do it. So in Slovenia, we are 2 million people, a very small country, and we have 4,000 people living in institutions, and they do not belong there. It's like a jail. You know, there are rules from the morning to evening. You don't have, rare of them have their own room and some privacy. So sorry, I stayed this slide. So what we wanted to do with my colleague was how to use the data that the Center, Andragogic Center of Slovenia does, how to use this data for our case, for our people coming from institutions to community. Because the keys mean my own house. So when we move these people from community, we don't want to happen like in America, to leave them on the street. We want to have a lot of activities for them, and to meet people and stuff like that. So the learning, or the non-formal learning and communities that already exist could be supportive for these people when they come, because they won't know anybody and they don't have usually a big social network. So they will need somebody to go with, to live with, when they come from institutions. And all the results that my colleague already presented, lower education, older age, rural or small towns and disability, these are all the risks for community exclusion. And when we move people from institutions to the community, all these risks can also be there. So what we can do together to to prevent this is use this data, think about the barriers, remove the barriers before they happen, and create pathways. And why creating something new if we know that there exist communities and learning groups that could help these people getting to know each other and other people, and make their social network bigger. So we know these study circles from people's universities, but they're called a little bit different now.
Focus schools.
Okay, we want to use something that is already existing in Slovenia for years. How many years we know this study circles?
About 30 years.
About 30 years, and they are all over Slovenia. And why would we invent something new if we can use these educational process study circles that already are spread in Slovenia, and put these people, not just move them in-house, but also present them the way to learn in the community, in this circle, in these study circles. So we need our services with our organizations and ministry. We need local communities, and we need these existing pathways to help them live a new life that's more dignified. And later, of course, we can see how they improve. We don't want to leave them alone. We can check their participation, social ties. Do they have choice and control of their life and of their belonging? So this is the connection with the researching, continuous researching, and our cooperation. This is the time when I can present our third partner. So this is Jakob Schubitz from the Inner Peace Institute. Actually, he was the one who connected us. He's a really amazing person, working with children, teaching them in the forest, studying, let's say, a bit different areas, maybe not so from the field of learning in this meaning that we know, but a little bit different. And when I asked him, how can we present his part, he said, just put all the slides and let the people think about it. So the way how we can move people from institutions to community is with awareness, with compassion, with loving kindness and wisdom. And these are his slides he prepared. I just want you to read and think about it. And I can just say how proud we are that Jakob is our third partner to let us think of other dimensions, more spiritual, but very important to connect and to be successful. Jakob also believes that the environment is very important, and we've heard about that before. Nature is a place where many things can naturally happen.
So thank you.